we welcome you today. Today's episode, we're going to talk about health vibes with NatVibe Studios. My name is DDK. I'm your host for today. I want you to stay very tuned to your mobile phone, to your screens. Take very close attention. We are going to talk a lot about our health today. In that, I just want you to sit down, grab your seat, just stay tuned, and then let's go. Okay, guys, today we are going to talk about a very sensitive, important topic about our health. As I told you, my name is DDK and I'm from NatVibe Studios. Now, it's been a while. There's been the advent of a lot of diseases, and one important disease that we are going to talk about today is hepatitis B virus. I know most of you have heard about it. Maybe you've not heard about it, but you've seen a family member or a friend being diagnosed of having hepatitis B virus. One thing that you need to know is that it's a very, 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 very serious illness that a lot of people in Ghana have. You know, when you look at the survey that has been conducted in Ghana as of 2024, about 12 to 15% of Ghanaians have been diagnosed of having hepatitis B virus, and that is very serious. You know, when you talk about 12 to 15% of Ghanaians, you should understand that in Ghana, approximately we have about 34.4 million people in Ghana, and we can talk about 4 million of these people being diagnosed with hepatitis B virus. It's strange, right? It's very, very serious. We're going to talk about it, and we have to stay very tuned to it. I want you to sit down and then listen very carefully. You know, when we say that 12 to 50% of Ghanaians have hepatitis B virus, we mean that when you take 7 people in Ghana, 1 out of the 7 persons have hepatitis B virus. Yes. You heard me right. 1 out of 7. So if you are walking around and you see 7 people, remember that 1 person out of the 7 people have hepatitis B virus. Now, if you look at Africa, this virus is very prevalent in Africa, and Ghana is of no exception. We are number 4 in the whole of Africa, just behind Cameroon, Nigeria, and then South Sudan. Very, very dangerous. We have to talk about it, and you also have to take good care of yourself. Now, when you come to our region, we are in the Western region. Statistically, we have found out that about 13 to 16% of people in Western region have hepatitis B virus. That is very dangerous, and it's even greater than the national average of 12 to 15%. You should be very wary of it. Now, a lot of people would ask, okay, so who is at risk of getting hepatitis B virus? Now, from our statistics, we know that those people who have it are usually within the ages of 20 to 40, and usually pregnant women and very young adults. They are those ones that have hepatitis B virus. And how is this virus spread? Very important. We need to talk about it, because if you don't know how the virus goes about, you may go about and do things haphazardly, and then you may contract it. So let's talk about it. It is very important. Now, the first and foremost thing that you need to know is that this is a virus. Just like HIV virus, just like the virus that causes common cold, just like the viruses that attack the body. One major way that this hepatitis B virus attacks people in Ghana, including Africa as well, and the whole world, is through sexual transmission. When we say sexual transmission, we are talking about unprotected sexual transmission. So when you have unprotected sex with somebody who has hepatitis B virus, you are more likely to contract the disease. It is not just like very clear cut that when the person has it, you're also going to have it, but it increases your chances of having it. So you'd have to be very careful. Please make sure that your partners get tested first. Before you get in, you have to know where you're going, okay? So please get tested. The second most important way that people get it is from mothers to children. We call it mother-to-child transmission of the disease. When a mother has the hepatitis B virus, but she doesn't know, probably she contracted it from the husband. When you feel hormone, she got it from somebody else, but she didn't know. Then she got pregnant, and then she also refused to go for ANC, or when she went for ANC, they didn't test her for it, so she gave birth to the child, and the child has hepatitis B virus. Usually in Ghana, the most prevalent form of hepatitis B virus contraction or transmission is from the mothers to the children. So mothers, if you are a mother, if you are a young lady who has the ambition of getting children in the near future, you have to test yourself. You have to know your hepatitis B virus status, because it's a very serious disease that is affecting Ghanaians. So make sure about it. And sometimes too, when we go to the hospital and then we need blood, and then the blood is transfused to us, and then these blood, they are not well screened. You see, right now in our era, we get to understand that these things don't happen, because when the blood is, before the blood is transfused to you, it has to go through a very rigorous screening process. So all these viruses and everything that is toxic to the body is taken away, or the blood is expelled or thrown away and will never be given to the patient. But the two most important things that I want you to know today is sexual transmission and then mother to child transmission. Please be very careful about having unprotected sex. And if you are also the type that you use unsterilized instruments, for example, this person uses the nail cutter, this person also uses it, this person uses the blade, you also use it, you are at risk of getting hepatitis B virus. Now, how do we say that someone has hepatitis B virus? What are you going to see in the person? What are some of the symptoms? In medical terms, we say, what are some of the symptoms? What are some of the signs that you're going to see in a person who has it? How or hepatitis B virus? No. Now, the virus usually, when it attacks the body, it doesn't come with a lot of symptoms. Okay, the symptoms progress over the years. It doesn't come just like suddenly. It just takes time before you see it. And so when someone has an acute infection of the disease, it just presents like the person having malaria. Okay, the person will come with fever. He will tell you, and you feel like you're feverish, and then you lose appetite. You are tired already. You realize that when you are urinating, the urine has changed color. It becomes very dark. You feel that your chest, this part of your chest, is paining you. You can feel that your stools, when you go to the private, you realize that the stools are very pale. Yes, it's giving you signs, and it's giving you the signal that you need to be very careful, and then see your GP very quickly, see your doctor, and then check on yourself. But in the late stages, when someone has hepatitis B and is untreated and it goes in for a very long time, that is when the disease progresses. Now, progressiveness of the disease will make you see a lot of symptoms. Now, these symptoms, it is very, very evident. You would come with jaundice. When you say jaundice, you see that your eyes is becoming very yellow. The person will open the hands, and then you see that the palms are getting yellowish. There's a lot of yellowing in the body. That is a lot of these chemicals that are inside our bodies. I don't want to mention names. You see those signs, and then you realize that these things are happening in your body. You feel a very, very itchy sensation. Even after taking your bath, even when you have not taken your bath, there is a lot of itchiness because of the chemicals that have been deposited in your skin because of this hepatitis B virus that has progressed to chronic hepatitis B. So please, let us be very careful. Now, why should we be concerned? Why should we talk about hepatitis B today? Now, we can talk about it, and we must talk about it. One, because of the way that the disease is progressing throughout the country. We have to understand that every day people are getting infected with it. Every day people are getting infected with it. And once it gets into your liver, the virus attacks basically your liver. Okay, that is where the virus stays. You know, the liver performs a variety of functions. In medical terms, we understand that the liver performs more than 500 functions, but we know from basic literature that the liver is able to metabolize glucose and metabolize carbohydrates and proteins and fats and store glycogen and all that. Everything, even when you take poisonous substances, when you take paracetamol and it's overdosed, is the function of your liver to just remove this toxic waste from your body. So the liver is, if I should say, the most important, I don't want to say the most important, but one of the most important organs in our body that we need to be very careful with. So this hepatitis B virus affects this function. And so if we don't look at it well, if we don't get it concerned, okay, we don't let it concern us, it can just lead to chronic liver diseases and what we call hepatocellular carcinoma or liver cancer. A lot of people are in Ghanaian wards. When you come to the medical wards, when you go to the big hospitals, you can see a lot of people in their end of life and having hepatocellular carcinoma. In Ghana, the average time that these persons can stay alive is even less than a year. By 6 months, 7 months, the person is just dead. So you need to be very careful and take care of your health, because this disease is quite dangerous, very dangerous. Let's take care of ourselves. Now, what do we do? What do we do? First of all, you need to get screened, okay? If you have not been screened for hepatitis B virus, I would admonish you and I would beg you today that please make sure that you go to the hospital and then you get yourself screened. Please, when you get yourself screened and then you are negative, praise the Lord. Now, once you are negative, please, that's not all. You are supposed to get vaccinated. I don't know how many of you who have had the hepatitis B vaccine, but it's 3 doses. You're supposed to take it periodically, just an interval of a month, okay? You are supposed to get tested first. Before you establish a sexual relationship with your partner, please make sure that you get tested first. Get tested first. If not for HIV, if not for any venereal disease, just get tested for hepatitis B virus, because it can kill you. It is a beatable virus, but it can harm you. Please get tested, get vaccinated, and please break the chain of transmission. Make sure that if you don't have the health status of your partner in mind, you meet this person one time, you are very interested in him, you want to do the do, please make sure that you use barrier protection. Use condoms, condomize. If you can't abstain, please be faithful to your partner. If you can't be faithful to your partner, condomize. However way that you are doing it, please use condoms for yourself. And when you are being diagnosed of having hepatitis B virus, please don't be scared. Don't fret. I don't want you to get scared that you are going to die. You are not going to die just yet. In your you would have to continuously get treatments. That is why I'm saying that the most important thing for you today watching me, DDK, is that please make sure that you visit the health center. Get tested for hepatitis B virus. When you are negative, please go and get your vaccines, and then make sure that you have barrier protection whenever you are having sexual intercourse with a partner that you don't know the health status. You get me? Yes, I know you get me. My final message for everybody, all and sundry, everywhere, nook and cranny watching me today, is that hepatitis B is real and is very beatable. Stay informed, stay safe, and stay healthy, because your health is your wealth. You need to stay healthy to enjoy the fruit of your labor. Thank you, guys. See you next time on Health Tips on NatVibe Studios. Let's go.